Hello and welcome to our show, Health and Wellness, Myths versus Facts. When people think about hormones, they probably think of the most common male and female hormones, testosterone and estrogen. However, children as well as adults produce many other kinds of hormones that affect every aspect of their health. The growth, development, moods and even character formation of your child depends on this endocrine system. Hormones play a particularly important role in regulating growth and development, cognition, metabolism, hunger, thirst, reproduction as well as sexual function. These processes are extremely important for the normal development of young children. Hormonal imbalance in children can cause serious consequences. The burden and the pattern of pediatric endocrine disorders are increasing worldwide. Symptoms of hormonal imbalances can vary widely as each hormone is responsible for its own role. Awareness of hormone imbalance in children is not very high, and therefore parents do need to know much more about the endocrine disorders, and the accurate knowledge will help parents to recognize the symptoms in time in order to consult a doctor accordingly. We've invited our expert doctors and endocrinologists to provide medically accurate advice on preventing various endocrine conditions in children and help viewers identify long-term control strategies. Let me just welcome, we have Dr. M.V. Ramamohan, consultant endocrinologist. This is at the Diabetes and Endocrine Clinic in Nellore. We also have Dr. Girdhar Adappa, endocrinologist at Manipal Hospital in Vijayawada, and Dr. Minnie Pillai, consultant endocrinologist, Lakshmi Hospital in Kochi. Well, thank you so much for joining us here on NDTV. Let me take my first question about hormones. How do hormones act on every cell, every organ, every bodily process and every bodily function? Do hormone disorders, can they occur in children, and how common are these hormonal imbalances in children? Dr. Adappa, if you could answer that.
Yeah. So thank you very much, Divya, for that question. So hormonal imbalance can occur in children. So most common endocrine disorders. So hormonal imbalance, we will call it as endocrine disorders. So these are due to imbalances in our pituitary, thyroid, pancreas, adrenal and gonads. So because of this hormonal imbalance can occur. So most common among these are, so all of us know thyroid. So because of abnormal thyroid hormone levels, patients will have either hypothyroidism or hyperthyroidism. So hypothyroidism congenital or juvenile hypothyroidism, most common endocrine disorder in children. And pediatric obesity, nowadays we are seeing it is rampant because of excessive eating, change in lifestyle. That is another one. Next, type 1 diabetes. So type 1 diabetes occur because of deficiency of insulin hormone. So it leads to type 1 diabetes. And another one, recently we are seeing premature puberty and delayed puberty. So because of obesity, because of hormonal imbalance, puberty can occur early or puberty can occur late. So another problem is short stature. So many parents will come with children, they are not able to grow. So short stature, it is because of poor diet or because of growth hormone deficiency. So these lead to short stature. So and adrenal disorders, some patient will come with a patient is having weight loss, so another symptoms, so and hyperpigmentation. So patient will have adrenal insufficiency. So where life-saving hormone cortisol will be secreted, so it will be deficient. So these are the most common endocrine disorders we will see in childhood. It can occur and do occur in children.
Right. Now, as we've already discussed, an imbalance of hormones in a child can cause bothersome and often serious problems. What are the causes of hormonal imbalance in children? Dr. Mohan, if you could take that question.
Good morning, Divya. So we know that because of these hormonal changes, the childhood will be affected, and it is indeed very important to know that any problems in hormones in childhood should be treated. And mainly the causes for this hormonal imbalance in childhood are mainly maybe the pituitary tumors, any of the tumors in the pituitary, or many lifestyle diseases like obesity, lack of physical activity, and excessive intake of junk hormones these days by kids. All these things will lead to obesity, will lead to hormonal imbalance in young adolescent girls and boys. And also we need to see for any thyroid disorders in our patients, so that any thyroid problems in childhood may lead to short stature or obesity. So that the main causes of these are genetic causes, environmental and acquired causes are also there.
Right. At what age does hormonal imbalance occur in children? Can these hormonal imbalances be prevented? Dr. Pillai.
Yeah, thank you for this question. Actually, at any age, hormone imbalances can occur at any age, and the most important, probably, congenital hypothyroidism, that is, inadequate thyroid hormones at birth itself. That is the most important cause for preventable mental retardation, and it can occur in up to 1 in 1,000 newborn babies in our country. So that is a very important hormone imbalance in children. And another thing that we usually come is childhood obesity that we commonly see, and this also can occur at any age. So coming to prevention, childhood obesity especially is very much preventable if adequate attention is given to lifestyle. So the most important thing is promote physical activity. Even in a young infant, you can promote more of tummy time, that is, child lying on the stomach. And up to 3 years or 4 years of age, at least the baby should be active physically during all of the waking hours. And an older child should be active for at least 3 hours. And even an adolescent or teenager should be physically active for at least 1 hour a day. And physical activity in a child is more of sports, dance, martial arts, etc., rather than walking or running or going to the gym. And another important thing is diet for prevention of childhood obesity. We should avoid sweets and savories, limit intake of sweets and savories, and also avoid red meat, that is meat of all four-legged animals at least, and also all junk food, limit consumption. That is very, very important. And other endocrine diseases are not that much preventable.
Right. Dr. Adappa, what are the signs and symptoms of hormonal imbalances in children and adolescents? Dr. Adappa.
Disorder. Suppose patient is having thyroid dysfunction, so patient will have short stature, weight gain. Patient will be obese, and patient is having hair fall, facial puffiness, and pedal edema, and constipation, so dry skin, and low intelligence, low IQ. So if the hypothyroid affects during fetus hypothyroidism, so congenital hypothyroidism patient will have, if unable to find and screen, and if you're unable to start treatment early stages, so patient will have mental retardation. So type 1 diabetes. So type 1 patient will have polyuria, means increased urination, polydipsia, so increased thirst, and polyphagia, excessive eating. Apart from that, patient will have weight loss because of uncontrolled sugars. They will have weight loss. And if we take obesity, so pediatric obesity nowadays common because of lifestyle changes. So patient will have weight gain. And premature puberty. Suppose 8 to 13 years is a normal puberty age for females. If puberty occurs before 8 years, we will call it as premature puberty. So they will present with the breast enlargement before 8 years, and after 14 years, some patients will have without, there is no breast development. We will call it as delayed puberty in females. In males, patient will have before 8 years testicular enlargement, before 9 years. So, and after 14 years, patient unable to enlarge their testes. So that we will call it as a delayed puberty. So depending upon the disorder, symptoms will be there. So short stature, patient mainly will have, so parents will come, we are giving enough food, but he is not able to gain weight, height. So it is because of growth hormone deficiency. So we will test for growth hormone and we will treat. So depending upon the endocrine gland involved, symptoms will be there.
Right. The prevalence of overweight and obesity in children and adolescents has increased dramatically. Are hormones a cause of weight gain in children? Which hormone is responsible for weight gain? If Dr. Mohan could answer that.
Yeah, mainly in childhood, obesity is like a pandemic now in our India. See, our children go to school at 7 a.m. They come back at 7:30 p.m. and they don't have time to play around. And we know, being parents also, we insist on studies, and we are not giving enough physical activity to all our children, and they are always sedentary. So mainly the obesity is caused by the sedentary lifestyle and lack of physical activity, and some hormones also change after development of physical activity. Mainly it can be prevented, and some hormone diseases like hypothyroidism, growth hormone deficiency will have obesity in children, and young adolescent girls will have polycystic ovary syndrome, where there will be obesity associated menstrual irregularities can occur in these people. Mainly, obesity is preventable, and we know that most of our children need to play around in the school, also in the home, and then they need to be given some specific time for having physical activity, so that these hormone disorders can be prevented in the children.
Right. Dr. Pillai, is it possible to reverse a weight gain associated with hormonal imbalance in children? Doctor.
Like Dr. Ramohan was saying very correctly, most of the obesity that we see in childhood is related to energy imbalance. That is, a child consuming more calories than what is required for the activities and growth. So this has to be dealt with at that level. That is lifestyle intervention. And coming to hormone disorders leading to overweight or obesity, it is of course very much treatable. One important thing is thyroid disorders, which can cause some weight gain, and that can be very effectively treated. And another thing is cortisol excess. Cortisol excess also has a very good effective treatment if managed correctly. And another is abnormalities occurring in the hypothalamo-pituitary area. These also sometimes cause overweight obesity issues. These also can be treated. And most importantly, the childhood obesity that we usually see, that is dealt with lifestyle. And another important thing is polycystic ovary syndrome, which also is often associated with overweight and obesity. And here also effective treatment options are available, which should be combined with lifestyle measures.
Right. With that, we're slipping into a very short break on our show, Health and Wellness, Myths versus Facts. We'll be back with expert doctors on the other side. Welcome back on our show, Health and Wellness, Myth versus Facts. Let's get you some of our questions regarding hormones. This question is to Dr. Adappa. Dr. Adappa, how important are thyroid hormones for a child's development? Doctor.
Yeah, definitely thyroid hormones are essential in every stage of development. So mainly in younger children, so thyroid hormones are essential for brain development and growth. So it causes neural cells differentiation and myelination. So in our brain and spinal cord, and thyroid hormones basically control the metabolic rate in our body. So BMR or basal metabolic rate depends upon the thyroid hormone levels, and thyroid hormones are essential for bone growth and maturation. So thyroid hormones stimulate the production of the growth factors that are essential for bone growth and maturation. So apart from that, every system is involved. Thyroid hormones. Suppose on gastrointestinal motility also depends upon the thyroid hormone, or cardiovascular system, so our heart rate. So everything, whatnot. So every organ is dependent on thyroid hormones. If there is any imbalance in thyroid hormones, so definitely growth will be delayed in children, and brain maturation also won't be there properly.
Right. Now, what happens when a child has thyroid problems? How can thyroid disease in children be prevented? Dr. Mohan.
Yeah, any obese child, any inactive child, any child with weight gain, constipation, inactive in the school, with dry skin, any menstrual irregularities in the children, young children, these children should be tested for hypothyroid thyroid function test. So early detection of hypothyroidism is very important, so that these complications due to this disease can be prevented. One more thing is adequate iodine fortification of salt is very important, and still in so many places in India we are having that rock salt is used in spite of availability of iodized salt. So proper iodine availability should be there to every kid in the fortification. And also all the obese children, any children with hypothyroid symptom could be tested, so that early detection is very important in thyroid diseases, so that they have a good growth, they have a good metabolism in their body, and they can flourish well in their studies and in their activities in the future.
Right. Now, what are the treatment options for thyroid disorders in children? Dr. Pillai.
Yeah, actually, like Dr. Ramohan was saying, early detection and treatment of thyroid disorders are very, very important to prevent the consequences. And the treatment essentially depends on the nature of the disease. Most common is underactive thyroid. Underactive thyroid is very easily treated with thyroid replacement, that is thyroid hormone replacement, and these tablets are very small, very cheap, and not even bitter, and has to be taken only once daily. So very effective treatment and very safe to take lifelong. And another common thyroid disorder is overactive thyroid. So first we spoke of underactive. Now overactive thyroid can also occur in a child, and here also we have very similarly very effective medications, though very rarely the child may even require surgery, very rarely. And the third class is thyroid swellings of the thyroid gland, and again most of the time it may be associated with thyroid hormone abnormalities in the blood, which means they may be treated medically with very widely available medicines. But occasionally we may need surgery, especially when cancer is suspected in the thyroid gland, which can occur even in a child. So in such children, surgery may be required.
Right. Now, does childhood obesity affect puberty? Dr. Adappa.
Yeah, definitely. So childhood obesity causes hormonal imbalance and affect puberty. So studies showed overweight and obese children, the onset of puberty is different in girls and boys. So obesity causes premature puberty in girls and it delays puberty in boys. So main reason is because of, so in obesity there are some hormone resistance are there, hyperinsulinemia, insulin resistance, and increased androgens and leptin resistance. So these all stimulate pituitary axis, so gonadotropin axis, which stimulate our puberty. So because of obesity, so there is an acceleration of somatic growth and puberty. And apart from that, the obese children, so compared with the same age and sex, so they tend to be more height, so they tend to reach puberty earlier, especially in the girls. So definitely obesity will affect puberty.
My next question is for Dr. Mohan. Doctor, can thyroid disorder pass from a mother to a child?
Generally, these thyroid disorders are two types. Maybe congenital thyroid disorders due to mutations in the thyroid hormone producing gland, where there are defects in the thyroid hormone production. This is called congenital hypothyroidism. Then comes the acquired hypothyroidism because of iodine deficiency. In the young adults, young children, and in the adults, it has autoimmune disorder. That is because of antibodies against thyroid gland. So, for example, if a mother has a thyroid autoimmunity, hypothyroidism with TPO, thyroid peroxidase antibodies positive, then their children at later ages can develop. There is a high chances of them going into hypothyroidism. So, mainly when you have a family history of hypothyroidism with patients, children having obesity, we tend to screen them for thyroid disorders. So, any family history of either mother or father, uncles or aunts or grandparents having hypothyroidism, the kids can be screened for thyroid disorder so that we can detect in early stages and prevent the thyroid complications in their future. And also any newborn kids in the newborns, we have to do screening, thyroid screening, so that early detection in hypothyroidism, congenital hypothyroidism occurring in newborns is very important, so that first 1 to 2 years of brain development is mostly depending on the thyroid hormones. So early detection of congenital hypothyroidism and treatment will lead to better neuronal development in the future for the kid. So if you are not treating a newborn kid with a hypothyroidism with thyroid tablets, that means that they have a congenital hypothyroidism and they have neuronal defects leading to mental retardation. So the most common cause for mental retardation is thyroid deficiency in newborns, so that every newborn should be screened for hypothyroid disorders.
Right. So how do hormones affect a child's cognitive development? Dr. Pillai, if you could answer that for us.
Again, I think all of us have been stressing again and again on the importance of thyroid hormone in early brain development. So, and this is quite common also. It is not that it is a very rare hormone disorder. It can occur in up to 1 in 1,000 of newborns in our country itself. So many studies have shown that even up to 1 in 700 in a study from Kerala. So it is essential. It is unfortunate that newborn thyroid screening is still not the norm in our country. Though many hospitals do it out of their own initiative, universal screening for thyroid disease at birth is still not available in our country. So we should adopt this as early as possible so that each child with congenital hypothyroidism, which basically means thyroid hormone inadequacy at birth, is detected as early as possible and consequences like mental retardation are prevented. Because thyroid hormone is very, very important in the development of brain as well as in physical growth. Each and every milestone. Suppose we miss the hypothyroidism at birth. Any delay in any developmental milestone, like delay in dentition, delay in the physical growth, so any delay in menstruation, anything, delay in puberty, anything can be due to inadequate thyroid hormones. So that should be checked. It is a very simple blood test to check TSH. Just checking TSH is enough most of the time to diagnose hypothyroidism, that is inadequate thyroid hormone levels, and it has very effective treatment. So the thyroid hormone is the most important hormone for cognition. Then other things like hypocalcemia, disorders which can cause calcium imbalance, is very important. Like calcium is very important in normal cognition. So both inadequate calcium levels as well as increased calcium levels can interfere with cognition, that is the mental skills, mental faculties in a child. And similarly, there are disorders. These are rarer disorders like Turner syndrome, Klinefelter syndrome, etc., which can interfere with pubertal development. All these can also be associated with cognitive impairment, that is lack of enough mental faculty development in a child.
Thank you so much, Dr. Pillai, Dr. Adappa and Dr. Mohan for breaking it down for us here on our show Health and Wellness, Myths versus Fact on NDTV 24/7. Thank you so much for your time.